Hi, I'm Angelique Roche, and you are watching Very Biggest Questions, a series of complex and ever evolving conversations on topics that, frankly, keep us all up at night. Is tech actually helping us connect? Do we still need faith in the 21st century? When will this all be over? Sorry, I actually don't have that answer, but when I do, I will let you know. And tonight we're going to be discussing something that has definitely been keeping me up at night: the state of civil liberties during a pandemic. How do our basic civil rights fare as the federal, state, and local governments are enacting or not enacting policies using emergency powers and orders that are considered for the health, safety, and welfare of our communities? For over a month, we've all been asked to stay inside, to avoid public spaces for the greater good. And it's incredibly important that we do these things and do our best to flatten the curve. But what's the impact? While we're taking these measures, we wanted to examine the bigger picture and talk about what's happening amidst the chaos, and what are or could we be doing, and what are and could be the long lasting impacts of these actions, and how do we protect and maybe even strengthen our constitutional rights while we're being asked to, in some cases, put them aside. It would be putting it lightly to say that a lot of things are happening right now. I mean, honestly, it would be the understatement of 2020. As communities around the country continue to see the devastating impacts of COVID 19, thousands of healthcare professionals, first responders, nurses, and other heroes in the medical industry, including custodians and other workers who are keeping up the different facilities that are helping people, grocery store employees, delivery workers, MTA employees, and so many others have stepped up to continue their work as essential workers, something that is nothing less than heroic. But we're also seeing what many may consider areas of concern: broader moves towards a textbook definition of authoritarian state, tremendous data collection by private companies with little to no oversight, disparate, disparate policing, targeting vulnerable communities with violations, and setting a new precedent for suspicious searches. Political moves to shut down women's reproductive health care centers, a rise in xenophobia, scapegoating individual populations, not to mention coronavirus outbreaks in state and local prisons in like Louisiana, Georgia, Florida, to name a few, without giving inmates release or staff the resources to stop or slow the spread of the virus. So today, we've invited some brilliant minds and hearts to tackle this very big question, and a couple of other big questions that are held within. Should a pandemic pause our civil liberties? Who, if anyone, has the power to restrict our lives and encroach on our privacy? What are the precedents that exist for a rollback of our rights during emergencies? And who is most affected by these law enforcement and security measures? And what does all of this mean for the country going forward? Before we jump in, I want to say a big thank you to our partner, the Brennan Center for Justice at NYU School of Law, who definitely was a huge part of this happening tonight. We also want to let you know that we want you to be part of the conversation. Um, so engage us live by dropping in our live feeds on Facebook and YouTube. And we hope that we can answer as many of your questions in the stream as well. All right, so I am excited to introduce our amazing panelists who have been so patiently waiting in our virtual green room. First, I would like to welcome Faiza Patel. Faiza serves as the co-director of the Brennan Center's Liberty and National Security Program. She has testified before Congress opposing the dragnet surveillance of Muslims, organized advocacy efforts against state laws designed to incite fear of Islam, and developed legislation creating an independent inspector general for the New York Police Department. Patel also authored or co-authored several Brennan Center reports and is a frequent commentator on national security and counterterrorism for media outlets such as the New York Times, Washington Post, Economist, Guardian, NPR, and others. Next, we have Amal Sinha. executive director of the ACLU New Jersey, where he took the helm in 2017. But prior to joining the ACLU, was a policy advocate at the Innocence Project and has served as the director of the Suffolk County chapter of the New York Civil Liberties Union. Amal is also an adjunct professor at Marymount Manhattan College. And last but certainly not least, Masha Gessen. Sorry, Masha. I can see her, see them in the virtual green looking at me like, you almost had it. Masha is the author of 11 books, including the National Book Award winning The Future is History, How Totalitarianism Reclaimed Russia, and The Man Without a Face, The Unlikely Rise of Vladimir Putin. A staff writer at The New Yorker and the recipient of numerous awards, including the Guggenheim Fellowship and a Carnegie Fellowship. Gessen teaches at Amherst College and lives in New York City. I would like to welcome all of you. Thank you for letting me murder over your bios, and welcome to the show. So I want to start off with, very basic, because I think a lot of folks who are tuned in hear the word civil liberties, and it is a very big word with a lot of interpretations. So I would first to say, it'd be fair that like a lot of people don't necessarily understand what civil liberties actually are. Amal, as the executive director of the American Civil Liberties Union, can you share a definition that we can work with for tonight?
Sure thing. Well, first of all, thank you for having me. Thank you to the Green Space and the Brennan Center for arranging this. So a definition of civil liberties, it's those rights that are protected by the Constitution. And traditionally what we're looking at are the Bill of Rights to the Constitution, which includes the First Amendment right to free speech, the freedom of religion, the prohibition on an establishment of religion, the Fourth Amendment right to be free from unreasonable government seizures and searches. And also we throw in there the 14th Amendment right, which captures the equal protection under the law that we're all guaranteed to. So those are in a nutshell, the civil liberties that we're most predominantly occupied with. Of course, there are a whole bunch of other things in the Bill of Rights that we can touch on, but that is a snapshot.
So, and I think this question will kind of go out for everyone, but Amal, I'd like you to kind of pitch it off as well. What are these emergency powers we're hearing about? Because for those who went to law school and for those who worked in policy, emergency powers is something that you've heard a number of times, particularly on a state and a federal level. But can you give me an idea, local, state, federal, what does emergency powers and this idea of declaring a state of emergency really mean?
Thank you for the question. So what it means is that, look, we all recognize that in certain moments in our time here, that because of real risks to public safety, the government has a little more power to control our lives than it normally does. And that includes, for instance, if there's a very simple example here, if there's a hurricane happening and there's a public beach somewhere, the government may have the ability to close that beach, even though under the Constitution, I have the right to go and protest on that public beach. And that's because it's identified a greater harm here to the public, and it has a compelling interest to stop us from going out there en masse and taking time on that beach when we could be when our lives could be in danger as a result. So it's the expansion of these powers that we should be a little skeptical of, but also have to understand when emergency hits. And it happens at every level. It happens at the executive level in the presidency. It happens at the government, at the state government, at the governor's office. It happens locally in municipalities across the country with mayors.
And it's interesting because you mentioned a number of different things within this idea of civil liberties. FISA, civil liberties also expands out to privacy, particularly, including technology. And I think that is something that's really arisen as just a unique situation right now. For instance, extensive contact tracing by people and through technology, and how it's held it's held up one of the key factors in helping to like help stop the disease, slow it down, but it's also opening up its own bag of problems. What it's, if any, the concerns with deploying a tech solution? Because it seems like people are very ready to say we can solve it with tech, we can solve it with the internet, because we do desperately need to do this extensive contact tracing. But you've made some statements about tech might not be the right way to go, particularly by private companies.
So I think what I would say is that the tech is not a panacea. And what all of us are looking for right now, basically, is in essence, two sorts of civil liberties that we're trying to balance. I mean, not being able to go out of your house except to go to the grocery store is also a massive deprivation of civil liberties, right? And we all accept that as, there's a public health emergency and there's a good reason why the government is doing this. Um, and then now you're talking about a situation where we are looking for ways to get out of these blanket stay-at-home orders. And so in order to do that, what we need to be able to do is that we need to be able to track and trace people who are positive for COVID-19 and who their contacts are, because that is the population that's vulnerable, right? They may not be showing symptoms yet. We know that asymptomatic carriers are very typical. So we need to be able to trace that. And the numbers are huge, right? They're way beyond the normal kind of contact tracing that we've seen in the past, for example, with H1N1 or other diseases. So we need to find a solution. And there's sort of two options. And I don't think they're at all mutually exclusive, but rather have to go hand in hand. So one is to massively ramp up our public health capacity to do manual contact tracing. And we've seen already that states are making moves towards that. Massachusetts hired an additional 1,000 people, which is going to be a very small part of it. I mean, most estimates suggest that we need between 100,000 and 300,000 people. So I'm hopeful that funding is forthcoming from the federal government to support state public health authorities in this venture. The sort of supplementary solution, which can work hand in hand with manual contact tracing, is using some kind of app, right? So everybody knows we have tons of information on our phones, and that companies like AT&T and Facebook and mobile ad distributors, they all have a lot of information about that. Is there some way that we can use that information to make contact tracing more efficient? And I think there are some ways that we can do it, and some are better and some are worse. So I think one thing to kind of remember, though, when we talk about tech in this context, is that when you're talking about public health, you're talking about people's personal health information. It is perhaps one of the most intimate pieces of information that is out there, and people realize that, right? You don't want to tell everybody, all your aches and pains. So it's personal information. And in order for any tech solution, even a supplementary one, to be successful, we have to earn people's trust. People have to be convinced that, yes, this makes sense for me to do. It's going to help public health. It's going to be effective. And also that my private information is going to be protected. So when we look at tech options, we have to look at them through the kind of public trust lens, I think.
And it's a very interesting point. And I think also there's just, I feel like people really want to get this done as quickly as possible because there is this sense of urgency, right? As people are building these things out, like, do you feel like they're in building that trust? What are the balances that keep this from being an overreach, and are there long lasting effects, particularly when you're dealing with including private companies that are collecting this data?
Well, so first of all, private companies are collecting tons of your data already. I mean, so in some sense, that ship has sailed, and as a country, we haven't come together to come up with any kind of comprehensive privacy legislation that would protect any of us from Google or Facebook or anybody really, absorbing large amounts of data about us. So that's a given. Now, do they have information about, whether or not we're COVID-19 positive? No, that's the new piece of information that you are adding to it. But as I said, there are more and less privacy protective ways of doing this. And the most recent proposal, which has come out from Google and Apple, I guess it was last week. I can't keep track of the days anymore, really. Um, is actually pretty well structured to be privacy protective. And it does that in a couple of ways. So, one is that it tracks your proximity to somebody else rather than your location, right? So, it uses a Bluetooth signal. So, Angelique, if you and I are at a cafe, right, and assuming such a time ever becomes possible, my phone knows your phone is there because it can exchange a Bluetooth signal if we use this functionality, and that means that there's a way for me to know that I have been in proximity with you without necessarily knowing who you are, where you live, or anything about you. That information can be stored in an anonymized way on my phone. And if I were to then test positive for COVID-19, I could use that system to alert you, again, anonymously, again, voluntarily, that I have tested positive. So you have a risk of exposure, allowing you to then take the steps that you need to take to protect yourself and the health of others around you. It's not perfect, and there are different ways in which it could be manipulated, but as a starting point, it's a pretty good baseline.
Well, and on the other side of this, Masha, you had a great article, my personal opinion, that came out today,
Mhm.
that lays out this idea of an authoritarian state, and what that means, right? As the government, especially the federal, state, and local governments, are invoking these emergency powers you mentioned earlier, the people who have a say are becoming smaller and smaller and smaller, even in these conversations about what's being deployed in these partnerships with private companies, and the partnerships even with nonprofits that are happening in New York. And public life has ceased to exist in this little way, leaving little room for enfranchisement and self accountability. How concerned should we be right now about this?
I think we should be extremely concerned. And I also think we have to do some very hard thinking about how we think about this stuff. So, a couple of points. One is just, an authoritarian state. This is a term that we bandy about a lot because we think that anything that's not democratic is authoritarian. And that's one way of using the term. But there's actually, in political science, there's a very specific definition that is attached to authoritarianism. An authoritarian state is, simply put, a state where one person or a group of people wield power and amass power, and usually amass wealth, while other people are not participating in politics, while everybody else is tending to their private life, and there's no politics really in an authoritarian state, which is actually a distinction between an authoritarian state and a totalitarian state. In a totalitarian state, everything is political, everyone is in the public square, everyone is mobilized. In an authoritarian state, everyone is demobilized, everyone is sent home. And one of the really bizarre things about the current moment is that we're probably creating, at least for the next few months, right, in the last month, something that is as close to the textbook, like literally textbook model of an authoritarian state as we have ever seen. And this is where I would get to my second point, which is that we really have to think about how we think about rights, right? Usually in this country, we talk about rights as individual rights. I have the right to speak. I have the right to move. I have the right to gather with other people. But if we think about why these rights are so necessary, I would argue that it's not just a question of individual liberties, and maybe not even so much a question of individual liberties as a question of how we constitute our society. We want to hear many different opinions in the public sphere. We want there to be a public sphere. We want people to gather. That's why the right of association is so important. Not because it's some one person's right to gather together with their friends, but because as a society, we're actually based on this idea that we have people gathering, exchanging opinions, acting together, creating collective space, all of that. So what happens when we give that up for very, very good reasons? But also, what are we fighting for when we're fighting to bring it back? I think we're fighting to reconstitute our society, not just to give people back their individual rights.
So I think it's also interesting, and I kind of pose this question first to Masha, and then if anyone wants to chime in this idea of what people are thinking when it comes to society, when people are thinking when it comes to health, safety, and welfare. What has emerged in this crisis is interesting that people are substituting the word economy for what is best for the country, and not necessarily health and welfare, but the welfare of economics. How can we think about that moving forward collectively? And how do you think that's having an impact on some of the local, state, and federal actions that are going on right now?
Well, I'm so glad you brought that up, because really that's the only word we have when we hear, whether it's President Trump or Governor Cuomo, when they talk about going back to public life, they talk about reopening the economy, right? Instead of talking about reconstituting politics, instead of talking about bringing people back into public spaces, they're talking about bringing people back into stores, right? And a great example of that is, of course, how we're talking about schools, right? It has become so obvious, like more obvious than it has ever been, uh, to the general public. I think if we stop to think about it for a second, what schools are for. Schools are to warehouse children while their parents go to work, right? That's the way that we have thought about schools, right? So when we hear Governor Cuomo arguing with Mayor de Blasio about whether to open schools, they're not talking about the need of children to be with other children. They're not talking about the happiness and health and psychological welfare of children and their parents. They're talking about parents going to work so they can so we can restart the economy. And far be it for me to downgrade the importance of work. But really, if anything, if there was ever a moment when we needed to talk about people's value as human beings rather than as production units, this is the moment, right? And we haven't gotten past that.
Well, and again, this is for the entire group, but I'm going to toss this back because I'd love to have Masha kick this off. Do you think right now in this moment, in this pandemic, as we are in this shared experience and having this shared understanding, which I say that lightly because there's a lot more complexity to the experiences that Black and Brown folks are having, that incarcerated folks are having, that based upon your immigration status, what folks are having right now. Do you feel like you're seeing a sign that this exacerbation of these ideas, of these rights, are forcing us closer to this collective idea of thinking more, or is it just pushing folks more into this hyper individualization that is mine, 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 mine?
I'm really scared. Any crisis, like we know, any crisis is also a moment of opportunity. And it's a moment for us to be able to reconceive things. But we are so poorly positioned to do it because we're all separated, because we're having so many fewer conversations, because we have also stratified those conversations in such a way that they're not exchanges, right? We have a lot more sort of broadcasting power given over to some agents and very little sort of answering power, right? There's just there's not a lot of exchange happening. That's one of the things that scares me. And the other thing that scares me is that our track record of responding to crises is abysmal. Basically, every crisis that we have faced, say in the last 20 years, right? 9/11, we emerged with severely curtailed civil liberties and a very damaged democracy. The financial crisis of 2008, we emerged with exacerbated inequalities. Right? So what are we going to do now? What are we going to do when another crisis, now that we're facing another crisis that exposes these fissures?
Yeah.
Are we going to go down the road of exacerbating them yet again?
Yeah. And actually, I'd like to toss that kind to Amal. So,
yeah.
Because you bring up something that is very, very clear, which is there is a glaring exposure of systemic gaps in marginalized communities right now that are being disproportionately impacted. People of color, women, immigrants are being double impacted, both as many of them being essential workers and not having a living wage, not having quality health care, not having accessibility to child care, in many cases having a lack of PPE, personal protective equipment, and then being fined for it, or being targeted because they are out and they don't feel like it is a reason that they should be out, and being double fined for living in these places that are being targeted, and how do we hold these powers accountable, these powers that be, while we are separated, to ensure a fair distribution of resources and enforcement of both what is being implemented and what's not?
So let me say a little bit more about the inequities that you just pointed out, right? First of all, I've been saying all along, and the ACLU has been talking about this nationwide. The response to COVID-19 and the coronavirus is a racial justice issue, because what we're seeing right now is that every single institution in the United States since its founding has been plagued with systemic racism and inequity. And this is, as you said, Angelique, this is simply exacerbating those inequities and allowing them to surface and materialize in a way that we're all seeing right now. Black and brown people are going to bear the brunt of the healthcare inequity in this country right now. As we are seeing across the country, they're dying at a disproportionate rate because of this disease. We're seeing educational inequity. There are 150,000 children that don't have the technological infrastructure that they need in order to access remote education in New Jersey. And I guarantee you that a big percentage of them are Black and brown or immigrant kids. There's economic injustice everywhere, right? The people that are on the front lines at grocery stores or in the healthcare industry, if you look up, they're going to look like me and you, and they probably have immigrant backgrounds. And it's really important that we acknowledge that at the outset, because if and when we get through this, it'll be on the backs of people of color and immigrants, and I think that's something that we need to acknowledge collectively. In order to hold people accountable, we need to see what it is that folks are doing, right? Like, we need to be able to see what the government is doing in this time. What we're seeing right now is that the most vulnerable communities are disproportionately impacted. We are seeing people who are incarcerated that have no recourse. They have no ability to protect themselves, especially those who are medically vulnerable or elderly, being stuck in a place that even in good times, is vulnerable to the spread of disease. And we're seeing, we're seeing government action that's either insufficient or overzealous, and all of it impacts people. So what we don't want to see is government inaction when it comes to prisons, but overzealous government action when it comes to enforcement of stay-at-home orders that targets people of color and minority communities, like we're seeing all across the country right now. We're not going to, we shouldn't be criminalizing more people right now. We're not going to summons or arrest or fine our way out of this pandemic. But we're seeing that amped up right now. And as the ACLU, as a watchdog organization in New Jersey, we're keeping an eye on government at every single level to make sure that enforcement of any sorts of restrictions on the freedom of movement happen in an equitable way. And if they are overzealous, that we are taking steps to hold government accountable, whether that's through litigation or policy change.
Well, and I think this is interesting. And Faiza, I actually want to throw this next question your way, is that it seems like there's this subtle, it's a subtle agenda, and there's a lot of politics at play here. One prime example, health, safety, and welfare, is that some states are using COVID-19 to limit women's reproductive health care. That, there's been a pause on gender confirmation treatment and surgery because it's not deemed essential in this particular time. And it's really something that's being made in such a piecemeal way. And normally people would be able to go to court. people would be able to sue. People would be able to take a step forward. But what kind of recourse can people really have in this moment, if at all any?
Well, as Masha said, you never let a good emergency go to waste, right? People always have their political agendas that they try to drive through whenever they have an emergency. We saw it after 9/11, where the FBI had its wish list of things it wanted, and lo and behold, a month later, October 2001, it got it in the Patriot Act. So I think there's definitely an element of what you say, Angelique, happening, and you certainly see that with women's reproductive rights, et cetera, as you mentioned. I think that this is a time in which journalism is extraordinarily important for us. And I say this as somebody who's sometimes critical of journalists as well, but that for us to understand what is happening in the country when we are not able to go out and see what is happening, we really need that reliable, deeply reported information flow that allows people to understand what is happening. And I think it's important to understand that not all legal avenues are blocked. Lawsuits are still being filed. There are differences in how different courts are treating this, but you can certainly move forward with lawsuits. We know the Supreme Court is going to have oral argument via telephone for the first time in its history. So the court system is adapting. So to the extent that that is an option that's available. I think the difficulty is, and this maybe goes back to Marsha's point, which is when you're not organizing in person, when you're not connecting in person, when you're not sharing information in person, that is a very different dynamic, and it feels much more attenuated, right? I mean, organizing online will only take you so far. At the end of the day, we do need to have that physical connection. But since we don't, I think the main thing we can do right now is use the information that we get and to organize online, because sometimes that too can have an impact, and to support organizations that are actually challenging the inequities that we see coming to pass as under cover of COVID-19.
And I think it's very interesting because a glaring part of this really is what's happening in prisons. But there's been movement, right? There has been successes. Amal, like what was the process for you working with the ACLU and making the case of Governor Murphy to downsize the prison population? And what do you hope for this being a test case? Because there are so many people in prison, because it is not lost on me, and it should not be lost on anyone else. Your statement of these populations being fined for not being at home because of stay-at-home orders and not having necessarily the monetary means to pay them means eventually there will be larger prison populations. And so this seems like this very complicated catch-22, but in all of this, there is a win. And so what do you hope this produces?
So here in New Jersey, we are fighting on several different fronts. First, there's the incarcerated population in state prisons, the people that are convicted of more serious crimes. There's the county jail populations across the state where people are there for less serious crimes, or are sentenced to a term of less than a year, or are there for pretrial detention, which is the vast majority of people that are in county jail right now. And then there's immigration detention as well. There's 3 county jails in New Jersey that hold detainees for ICE, in addition to a private facility that holds hundreds, if not thousands, of people for ICE. And so we are trying to make sure that we dramatically reduce each of these, so that we limit the spread of the virus amongst these populations. And you asked about the commitment from Governor Murphy. We had been using every single tool. One of the greatest things about the ACLU, especially the ACLU of New Jersey, is that we have a policy shop, a communication shop, a legal shop, a political shop. And what we try to do is use integrated advocacy to make sure that we get our overarching goals done. We've always been about ending mass incarceration. Now there's just renewed urgency to it, because it's literally a life or death moment every single day. We've always been about ending immigration detention. Now it's more urgent than ever. We've always been about, making sure that healthcare is adequate and sanitary conditions are adequate in these facilities. Now, it could really kill you if it's not. And so what we want to make sure that we're doing every step of the way is using all of the levers that we can pull to influence our government to do the right thing. So we filed actions in court over the past several weeks. We filed emergency petitions to try to get the courts to do something about this, and that resulted in our state Supreme Court issuing an order assuming the release of every single person sentenced to county jail in New Jersey. We secured the release of 700 people through that order. Working with our partners at the Office of the Public Defender, we did that. We filed another another petition in court to do the same thing for prisons. But in the meantime, we also put some political pressure on Governor Murphy. We sent a letter to him. We had action items online where we sent hundreds, close to 1,000 emails directly to Governor Murphy asking him to do something about the prisons, especially the most vulnerable populations who are incarcerated. And what all that activity led to, speaking, some power to the idea of digital organizing, is it led to a moment where Governor Murphy acknowledged that something had to be done, and he issued an executive order calling for the release of, or the temporary release, the furlough of significant numbers of people, including the most vulnerable, the elderly. But as the ACLU, our job is to praise the good things, but also push for more, because what we're seeing right now is that this process isn't moving fast enough. We're seeing a process that is going to take some time to get people out, and as we know with this virus, every single day we're seeing increased numbers of people that are being affected or dying. So we need to move faster. We need to make sure that we dramatically reduce the prison population in New Jersey and across the country, and we need to do so to save lives, because the longer we wait, more people will die. So it was a combination of litigation, public pressure, narrative shaping, making sure that people are seeing people who are incarcerated as humans. And honestly, I want to make it, Angelique, I want to make it politically toxic in New Jersey and throughout the country, but my jurisdiction is Jersey. I want to make it politically toxic in New Jersey to allow people to die if they're incarcerated. We've talked throughout our history about being tough on crime. Forget that. Let's flip the script here and let's talk about how we're going to vote people out of office if they allow people to die in this moment. We're going to hold prosecutors accountable if they oppose the release of certain people who are incarcerated, if they don't pose a threat to society. And we're going to make sure our public knows what their representatives, their governor, their prosecutors, their state senators and assembly people stand for in this moment.
So we have two listener questions that I want to get to before we start getting to our little bit of a wrap up. And one actually relates to this. Stacy Gregg, who is watching on Facebook. Hi, Stacy. Federally held ICE detainees are local public health risks. Don't governors have the power to order them released on behalf of their state's health department recommendation? Can you speak to that, Amal?
Is that for me?
Yeah.
It's unclear to me what the governor can actually do regarding ICE detainees. We know that the governor has power over the county jails, but they are ICE detainees, and there's a tension there. We are pleading with ICE to release all ICE detainees right now. We are filing. We've been successful in several lawsuits within New Jersey and all around the country to individually release a number of people. What I will say to Stacy's comment is that ICE detainees in county jails are held there by county facilities. I would encourage Stacy and everybody else who's listening to put pressure on county facilities to stop taking more ICE detainees. Luckily in New Jersey, we have commitments from all three counties that hold them to stop taking new detainees, but also set up conditions so that people can remain safe if they are to be incarcerated, and also make sure that we limit the transfer of ICE detainees. So if we're not taking them in New Jersey, let's not send them to Texas or somewhere else. Let's just stop taking them altogether.
So one last question, answer it very, very quickly because we want to wrap up so that we can get final thoughts from everyone. But Faiza, I'm going to throw this your way. Mark is watching online and he wrote, I am a New York City school teacher. How does the new normal of remote learning impact the civil liberties of my students and myself as a Department of Education employee? Zoom's problems put a real spotlight on these concerns.
That is a great question. One of the things that we had been working on even before COVID-19 was looking at the expansion of school surveillance, right? So this is part of our trend of thinking tech is the magic for everything, which is that there have been really in response to school shootings and people's concerns about safety of school kids, there has already been an explosion in lots of companies selling different kinds of surveillance tools to schools. And student privacy and the privacy of minors is actually does have some protections under the law. But I think I would be very, very concerned about the data gathering that's happening in many of the programs that are being used to remotely teach young children. Everything from recording what people are saying to things that, for example, are aimed at assessing whether or not a student is paying attention. And there's like a whole range of measures over there that are really, really problematic. And in our leap to remote learning, I don't think that we have spent enough time and attention to figure those out. And I really, it's something that we've just started working on. So,
wow. So I want to start wrapping up, and I want to start with you, Masha. Do you think that we'll view civil liberties in a new light after we enter what everyone is now considering a new normal? And do you think we're on a road to trying to strengthen these civil liberties and rights as a collective?
In our profession, which is journalism, it is never a good idea to make predictions. They're always wrong. And really, our job is to report what's out there to the extent that we can, which is not huge at the moment. What's out there is really discouraging. What's out there is actually, worse thinking, even simpler thinking. And we've been in this moment for a long time. We've been in this politics of oversimplification, the denigration of expertise, the contempt for anything that's at all complex, right? That's sort of the nature of Trumpism, and it's very, very hard to answer that by saying, look, we have to think about it in more complicated ways. But that's really our only chance. Our only chance is to try to wrap our minds around these things that are so difficult to understand, right? Which is, it's very difficult to understand how something that is clearly sound public health policy is also an enormous threat to our, to the fabric of our society, right? And how do we balance those? How do we try to wrap our minds around that? That's really the conversation we should be having, rather than the conversation about, when do we reopen the economy?
Faiza, what do you think is an essential step to Americans? What do you think an essential step that Americans can take to prevent some of these encroachments, or, as some would say, Patriot Act 2.0 from emerging after this crisis resolves itself?
So I want to say a couple of things, if I may. So one is, we all tend to compare this moment to the post 9/11 moment and to the erosion of civil liberties that happened then. I actually think we need to be more complex, Masha, and more nuanced in our thinking about it, because it is quite a different beast over here. And there are sort of two things I do want to highlight, and I think it might help answer your question. So one is that after 9/11, a lot of some of the laws were passed in public because we passed laws in public, but most of the programs that came from those laws, including the big surveillance programs, were done in secret. Whereas here, we are now having a pretty open conversation. I'm not saying it's 100% open or that there's stuff we don't know, but we are actually having a very public conversation about how to respond to the current crisis and how surveillance will play a part in that. And I think that is really encouraging from my perspective. The second thing I'd point out is that, in the sort of post 9/11 world, there was always a sense that whatever the government was doing, it was to them, it wasn't to us, right? It was to the terrorists, it was to the brown people, it was to the Muslims. This is everybody, right? Not everybody, but almost everybody is under a stay-at-home order. If we turn the corner, when we turn the corner on this, we have some kind of contact tracing system, it's going to impact a whole lot of people. So I think there's a way in which the rubber hits the road really close to home in this situation, which might make it a little less dire for civil liberties than emergencies normally are. And I think it's important that this is almost like a wake-up moment for Americans to understand the way their civil liberties can be taken away from them by the government, and actually kind of stand up for that.
Amal, I want to throw the last question to you, and I do want to also open this up as we do our final comments to everyone. As some of you have said, thinking about civil liberties is kind of a high-minded enterprise. It is complex, and it should be. Not everyone is even aware of their rights in a more day-to-day circumstance. And that's why I really did want to start this conversation by defining civil liberties, because there are times where people do not know what their rights are. And it's not because they are ignoring them. And many times it's because there are other battles they are fighting. So getting down to this macro level and kind of hitting on, Faiza, what you said, and Masha, what you said about this understanding of making this a more complex conversation, how might we start to strengthen this awareness as we move forward?
So first of all, I think we have to acknowledge that privilege, the fact that privilege plays a big part of this, right? If you don't have the ability to eat or have shelter, what good are your constitutional rights otherwise, right? Like, if you don't have the ability to have a job that allows you stability in your life, you're probably not thinking about your right to free speech or free association. So I think, underlying all of this is we need a lot more. I think what this moment is laid bare is the importance of economic justice. But also in terms of civil liberties, I think it's important for organizations like mine to do a lot more public education, to go into community spaces and tell people about their rights and help answer questions about what those rights are. When we get out of this moment, I hope we do a postmortem and take a close look at things like who actually needs to be incarcerated in our society.
Mm-hmm.
If we are, so comfortable releasing thousands of people right now, or if we're growing comfortable with that idea, did we need to have them incarcerated in the first place? If we're comfortable allowing people to come out of immigration detention, isn't that whole scheme sort of a farce? If we are allowing people to be within their communities and take shelter and they're not causing any sort of mass public safety threat, and I hope we can understand the other inequities a little bit better as well, right? If we're in this moment in an emergency talking about educational inequity, shouldn't we develop an infrastructure that doesn't allow these inequities to exist in the first place? So I hope when we do come out of this that we're going to come out stronger. But I will say that civil liberties are, it's one thing to tout your civil liberties when times are okay, right? It's when they're tested in moments like this that their true strength is revealed. So if we are adamant about making sure that we are skeptical of the government in appropriate ways, applauding them when they do the right thing, but always asking for more. I thank Governor Murphy for the executive order, but we need to continue to push to do as much as possible right now, and make sure that we are monitoring enforcement every step of the way. Why is it that prisons look the way they do in our society? Why is it that the educational system and people that have access to it looks the way it does? And why is it that healthcare is doled out in the way that it is? And what can we do to fix those injustices so that when the next emergency arises, which it will, that we don't have the same problems that we're seeing right now?
Masha?
Right. So actually, I'll pick up on a couple of points that Amal made. And I just want to draw attention to what I think of as the dangers of emergency thinking. right? We always have a way of saying, okay, in these times, survival is most important, right? It's war thinking, and it's no accident that there's been a lot of war metaphor, right? Because war is when we start acting. We put aside everything that's unimportant, and we start acting just for the really important things, right? And that has a way of having a disproportionate negative impact on marginalized communities of all kinds. Just one example is the Samaritan's Rainbow Hospital in Central Park, which exists in violation of New York City and New York State laws, right? Very explicitly, right? In case somebody doesn't know, it's a hospital that requires staff to sign pledges saying that they hold Christian values and will not advance the homosexual agenda, or some such phrasing. It's clearly discriminatory against LGBTQ people. It's and there it is in the middle of Central Park. What's also upsetting to me is how we talk about it. There was an article in the New York Times yesterday, written by my friend Sherry Fink, which didn't mention this circumstance. It was this glowing article about this hospital, didn't mention this circumstance until it got to the 21st paragraph, right? And it called it a controversy. So suddenly, this blatant disenfranchisement of a group, of a large group of New Yorkers in this case, right, becomes a matter of controversy. And it's just the very language throws us back, 10, 15 years. And you can see, like on that small example, how in times of urgency and emergency, we just quickly start regressing in the kind of social progress that we have made. So that makes me really, really concerned about whether even emergency measures like reducing the prison population are going to have a good impact when we, so to speak, turn the corner, even if we know, if we even know, right, when we turn the corner. And I think what's essential is that we need to be talking about these things right now, right? Not just release some people from detention, release some people from county jails in order to stem the spread, but also to go the extra step of saying they shouldn't be there in the first place, right? Let's keep reminding ourselves and the public, to the extent we now have a public in this country, that these are things these are things that we're trying to fix now, not because they need to be temporarily suspended, but because they were wrong all along. If we fail to do that now, if we fail to also hold to account people that we should be holding to account, we're not going to be able to do it after. We can't postpone it.
All right, I'm going to toss it to Faiza for a final word before we close.
So I really agree with Masha that the war metaphor is really troubling in this context. Wars are something, they're very male, they're very military. You go out there, you conquer an enemy, you're done, it's finished, right? And this is something that is much more subtle and much longer and requires more care than war, I think, is really how I try to think about it. But I do think it's important that we do both of the things that, Amal said and that Masha said as well, which is, yes, we've got to move now. And yes, we have to also always keep in mind and remind everybody of the structural issues that have led us to this situation. And we also have to be sure that the emergency ends at some point in time, right? So, in New York, everyone's watching sort of the Cuomo fan show every day. And, certainly he is very reassuring, but he has also accumulated extraordinary emergency powers to himself with the consent of the legislature. They're set to expire, I believe, in April 2021. And we want to make sure that, when that time comes, that sun actually sets and doesn't keep going on. So I think it's important to keep our eye on that as well.
That, I think, ended this panel very beautifully. Thank you all at home for tuning in. This was a very big question, and it opened up the door to a lot of other very big questions. And I hope that you continue having this conversation at home, where where you can also continue in the comments as well on AOL. I mean, ooh, I just said AOL because I'm looking at them all. And H myself. You can also comment on Facebook and Twitter. Head over to the Instagram for the Green Space, and let us know if you have a very big question that you want us to address. And feel free to drop that into the comments or to email the green space at wnyc.org. Again, I want to extend a huge, huge, huge thank you to our panelists, Faiza Patel, co-director of the Brennan Center's Liberty and National Security Program at the Brennan Center for Justice at NYU School of Law, Amal Sinha, executive director of the ACLU New Jersey, and Masha Gessen, author and writer for The New Yorker, who will be releasing the forthcoming book, Surviving Autocracy, in June. We'll more information based upon the conversation we had tonight, I am sure. So stay tuned to announcements for our next show. And until then, we wish you good health. Good night.
That is me. All right. That's right. Everybody have shots or something.